This particular patient came in to our emergency room during flu season, right? So very heavy volume in our emergency department. He was 17 going on 18, showed up with what we call a worried well complaint, right? Worried about something that he actually didn't have. So the nurse who was taking care of him, as per routine, offered him an HIV test and said to me, I actually didn't think anything about this kid. He was going to sit there. He was young. They said everybody over 13. I offered him the test. He agreed to the test. It was reactive. His first CD4 count was 203 and 16%. So a stone's throw from a clinical AIDS diagnosis. When all was said and done, I asked him, can we cab you home? Because I know you've had a really long day. Where do you live? And how far away do you live? He said, I live 2.6 miles away. So I said, how do you know it's 2.6 miles away? He said, well, we learned in the visit, he's from Pittsburgh, but he's a young man who has sex with men and was thrown out of his house like some 3 years ago and had been, functionally homeless, had not seen a doctor in about 3 or 4 years, right? So he came down to stay with some family in Philadelphia, so he doesn't know Philly at all. So he knows that his house is 2.6 miles away because he plugged it into his phone, and his phone told him that the nearest hospital was at St. Christopher's Hospital for Children. And what struck me at that moment was that if he were standing someplace else, he would have been directed to another hospital. If that hospital doesn't have routine testing in their emergency department, which many don't, he would have come in and out with his worried well complaint, right? And the next time we would see him is when he has AIDS, right? And he walks into an emergency department sick, right? I could not stop thinking about that after he left, that, just where he was saved his life, right? That he came to a hospital that had routine testing. The one chance you have when he, makes contact with us in healthcare, this is it for him, right? And it's it for us. Are we gonna catch this or not? And it's kind of, for us, it was a defining moment in the emergency department for routine testing.